Goeienaand. Good evening, fellow South Africans. And very interesting what's happening in Durban. I showed a video the other day showing how the beach has changed there, but it's not the only thing that's changed, let me assure you. Affirmative action is alive and well in Durban, and this is why. The KwaZulu-Natal Health Department is sticking to its guns regarding the recruitment of blacks to fill all available posts for registrars, so no other racial group are going to get a look in. Doctors and advocacy groups raised concerns when the department gave a directive that the 100 registrar posts available for 2019 will be filled with black candidates. Registrar posts are jobs given to qualified doctors who wish to train to become specialists in various fields, such as community health, oncology, and gynecology. The department said there was an excess of coloured, white, and Indian registrars in KwaZulu-Natal and a shortfall of black registrars. Out of 314 registrars, 128 are black, 127 are Indian, 41 are white, and 18 are coloured. If no suitable candidates were found during the recruitment process, the posts would be re-advertised according to the directive. Requests for deviations would be considered, provided that those were convincingly motivated for. Health MEC Dr. Sibongisi Dlomo said that after difficulties were experienced in recruiting black candidates for these posts, a deviation was sought from the accounting officer. And he goes on to say, this is Dlomo saying, and out of a total of 77 register posts which are in the process of being finalized, 21 posts will be offered to non-black Africans. Addressing the imbalances of our shameful past of apartheid and separate development is not only an imperative, legislative mandate of government that must be fulfilled, but it is also the morally and socially right thing to do. To this end, government continues to implement legislation that is aimed at achieving some form of redress through the Employment Equity Act, he said. Dlomo said despite the department's best efforts, South Africa, including KwaZulu-Natal, remained an unequal society with limited opportunities for self-development for those who have been historically oppressed. He says, we still have a long way to go in the creation of a country, economy, and job market that is inclusive and free from unfair discrimination that we can be proud of. We therefore should remain unapologetic about addressing these imbalances of the past. The stance, however, did not sit well with a doctor practicing in the public health sector. Speaking on conditions of anonymity, the doctor said the recruitment process showed racial bias. The directive is blatantly discriminatory. This will impair services, delivery to patients in a system already crippled by a lack of doctors. If you design admission criteria based on race alone and ignore the quality of the candidate altogether, the training program begins to spiral and the entire system will break, he said. Mary De Haas, KwaZulu-Natal violence monitor and member of the Medical Rights Advocacy Network, said representativity was important, but any selection, regardless of race, should be based on academic performance in the first degree and ideally also an indication that the candidate had aptitude in that field. And De Haas said, above average academic performance is essentially for selection to any higher degree, plus some indication of real interest in the subject and demonstrated aptitude for it. The government has 25 years to implement non-racialism, including in medicine, and it has messed up badly because of bad education and mismanagement of health facilities. Well, we were just talking about education yesterday on this channel, and how terrible it is in South Africa. And the standard is just shocking. Anyway, the final comments are that the South African Medical Association said transformation was not about addressing the demographics alone, Dr. Zanili Bekicha, the Association KwaZulu-Natal Coastal Branch Chairperson, said there was a need to look at the health system as a whole, and the transformation in the sector would not be achieved overnight. Dr. Imran Kika, DA spokesman for health, said any attempt to redress the injustices of the past must ensure the commitment to stick to the Constitution. And he said any deviation in the form of any policy that causes the domination of one race over the other by exclusion is nothing more than aberration on our constitutional values and is racist. Well, there you have it. If you live in KwaZulu-Natal, the health system is not looking too good. Anyway, guys, please remember to subscribe to be kept informed, and have a great evening. Take care. Bye for now.